Welcome back to our latest deep dive, custom tailored just for you, our resident learner.
Yeah, we are so glad you're here with us today.
We really are. And today we have a very specific, almost surprisingly specific mission.
We do, and it's one that I think is going to resonate with a lot of people who are maybe, suffering in silence right now.
Exactly. We are trying to answer this question. Can pelvic floor physiotherapy actually help if a chronic cough is worsening vaginal laxity?
It sounds like such a random connection, right? Coughing and pelvic floor looseness.
It really does. But we've got a fantastic stack of sources today to figure this out. We are pulling from NHS patient leaflets, the Cleveland Clinic, and specialized guides from pelvic obstetric and gynecological physiotherapy.
Also known as POGP in the medical world. They have great, really practical insights.
Right. So the big hook here, the thing that just blew my mind in these sources, is that we often think vaginal laxity is just this inevitable, irreversible part of aging or childbirth.
Yeah, like it's just something you have to accept.
But actually, these seemingly unrelated respiratory issues, like having a chronic cough, are a major hidden culprit.
They absolutely are. But the good news is specialized physical therapy really holds the key to reversing it.
Which is huge. So to really understand how a cough causes damage, we kind of have to unpack what laxity actually means for someone living with it.
Right, because I think looseness doesn't even begin to cover it. It's just a surface descriptor.
Yeah, the sources make it clear it's not just a feeling of being a bit loose. It's often this deep, aching, dragging sensation.
I mean, people describe it as literally feeling like their internal organs are slowly bearing down or falling out.
Oh, wow. That sounds awful.
It's a heavy, constant physical burden.
Yeah.
And it leads to decreased sexual sensation, which, obviously impacts intimacy.
And self-esteem, right? I mean, you feel disconnected from your own body.
Exactly. People pull away from their partners. It takes a massive toll on your overall quality of life.
So let's connect the dots here. How on earth does a stubborn winter cold or asthma or a smoker's cough end up impacting the vaginal walls?
Well, it all comes down to physics, really.
Okay, I love a good analogy. So if we think about the core of the body as this, closed pressure cylinder.
Right. Picture a canister.
You've got the diaphragm at the very top doing the breathing. The abdominal and back muscles are the rigid walls around the sides.
Yeah, they hold everything in.
And the bottom of the cylinder is the pelvic floor. It's this muscular hammock stretching from the pubic bone to the tailbone.
That's a perfect way to visualize it.
So every time you cough violently, it's like the diaphragm turns into a heavy piston, just slamming down directly onto that hammock.
Yes. That downward force is what we call intra-abdominal pressure in the medical field.
So it's literally pressure inside the belly.
Exactly. Every time you clear your throat or sneeze or lift a heavy box, the pressure in that closed cylinder spikes.
And physics says that pressure has to go somewhere, right?
It has to go outward and downward.
So if you have a chronic cough, you are basically taking a hammer to that vulnerable hammock all day long.
Constantly. Now, a healthy pelvic floor is supposed to act as a dynamic brace. It pushes back.
Like a trampoline.
Yeah, like a trampoline. It contracts, it lifts up, and it closes the openings for the urethra and vagina to resist that downward push.
But if you subject it to constant, repetitive loading like hacking all winter, what happens?
You mechanically overstretch the connective tissue. The fascia and the muscles just get overloaded.
You stretch it way past its elastic limit.
Precisely. It stretches out permanently. That's the laxity.
And if it gets really bad...
Then you can transition from laxity to pelvic organ prolapse.
Wait, really? Prolapse? That's where the organs actually bulge into the vaginal canal, right?
Yes. The bladder or the uterus physically drop down because the hammock just gives way entirely.
That is terrifying. But we also have to remember this hammock might already be vulnerable before the coughing even starts.
Oh, definitely. You have to look at the context of a person's life.
Like pregnancy. That's a huge one.
It's the perfect storm. Pregnancy hormones, specifically one called relaxin, literally make your ligaments stretchier.
Well, yeah, it's in the name, relaxin. It relaxes everything for birth.
Right. And then vaginal childbirth itself physically stretches and sometimes tears those muscles and nerves.
Okay, so that's childbirth. But then there's menopause. And I want to pause on this because it's so important.
The hormonal shifts during menopause are massive.
We always hear about estrogen dropping and collagen loss causing facial wrinkles, but that exact same thing is happening inside the pelvis.
It's systemic. Estrogen depletion drastically reduces collagen production everywhere.
And collagen is like the glue, right? The structural protein.
It's what gives human tissue its tensile strength and elasticity. Without it, the vaginal walls become thin, dry, and just less resilient.
So you've got a hammock stretched by childbirth, weakened by menopause, and then you start hitting it with this heavy piston from an asthma cough.
It's a biological recipe for severe laxity.
Which begs the absolute most critical question.
Are you doomed?
Right. If I have asthma or I just have this cough I can't shake, am I just systematically destroying my pelvic floor every time I clear my lungs?
You're not doomed, I promise. This is exactly where specialized physical therapy steps in.
Thank goodness.
And the very first line of defense they teach is this functional technique known as the knack.
Okay, let's unpack this. Isn't the knack just a cute rebranded name for a Kegel?
I get that question a lot. But no, it's a very critical distinction.
Because we've all been told, do your Kegels at red lights. How is this different?
A standard Kegel is an isolation exercise. It's just for building general strength over time.
Like doing a bicep curl.
Exactly. But the knack is a highly targeted functional body skill. It is entirely about timing and coordination.
So it's not just about how hard you squeeze, but when you squeeze.
Yes. It's the conscious recruitment of the pelvic floor right before and during an activity that increases abdominal pressure.
So you're basically bracing for impact.
Precisely. You feel that tickle in your throat, you squeeze and lift those muscles before the cough even hits.
And you have to hold it.
You hold that strong contraction through the entire coughing fit. And then, this is just as important, you fully relax afterward.
Okay, I see. You're creating a rigid floor to bounce the pressure back up. But wait, shouldn't the body just do this on its own?
In a perfectly functioning system, yes. It's completely automatic.
So what breaks the system?
The brain is supposed to send a signal a millisecond before you cough. But physical trauma severs that connection.
Like the nerve gets damaged during childbirth.
Yes, the pudendal nerve gets stretched or compressed. The signal gets delayed.
And the sources mention that sometimes women literally just lose the reflex altogether.
They do. If you have chronic pain or you're always straining, the brain rewires itself to avoid using those muscles.
It just puts the reflex to sleep.
Exactly. So physical therapy isn't just muscle building, it's neuroplasticity. You are actively retraining the brain.
You're rebuilding the autopilot so it goes back to prepare, protect, cough, relax.
Right. With enough repetition, those neural pathways fire subconsciously again.
Okay, that makes total sense. Knowing when to squeeze is great. But, and I have to play devil's advocate here, what if the muscle is just way too weak to withstand the cough?
That is the reality for a lot of people. The knack stops new damage, but it doesn't rebuild the hammock.
Right, a paper-thin shield is still going to break under a heavy hit, even if your timing is perfect.
Which is why you need the long game. A rigorous, evidence-based physiotherapy blueprint.
And the clinical guidelines say this takes about 12 weeks of daily practice, right?
Yes, 3 to 5 times a day for 12 solid weeks.
Wow,
Yeah.
that feels like an eternity when you're just trying to get through the day without feeling like your organs are falling out.
I know. But you are trying to fundamentally alter tissue architecture. That takes time.
You're building actual muscle mass.
Exactly. And the pelvic floor is tricky because it has 2 totally different types of muscle fibers.
Okay, let's break those down. You've got the slow twitch and the fast twitch.
Yes. Let's start with slow twitch. These are your endurance workers.
The ones holding everything up against gravity all day long.
Right. They make up about 70% of the pelvic floor.
And how do you train them? The sources talk about slow pull-ups.
Yeah. You draw the muscles inward and upward, and you hold that maximal squeeze for up to 10 seconds.
10 seconds. That sounds agonizing if the muscle is already fatigued.
It is exhausting.
Yeah.
But you hold it, then you fully release and rest for 3 to 4 seconds.
And you repeat that up to 10 times.
Yes. That forces those slow twitch fibers to adapt.
Okay, so what about the remaining 30%, the fast twitch fibers?
Those are your sprinters. They sit dormant until you suddenly sneeze or trip.
And they have to fire instantly.
Exactly. So to train them, the regimen calls for quick squeezes.
Just short, explosive contractions, like 20 of them in a row.
Yep. Squeeze, release, squeeze, release. You're teaching the nervous system to recruit them instantly.
Here's my question. If you're doing a bicep curl, you look in the mirror, you see the muscle moving, the pelvic floor is completely internal.
Which makes it really hard to know if you're doing it right.
Right, if you push down instead of pulling up, you're making the laxity worse. So how do you even visualize this?
The most effective verbal cue from the medical literature is this. Imagine you are trying to stop passing wind or urine at the exact same time.
Oh, wow. That is a very specific visceral image.
It really works. It isolates that sensation of drawing up and closing off.
But the expert guides also mention some serious physiological guardrails, right?
Yes.
Well,
When people strain to hold that 10-second pull-up, they cheat.
they try to borrow strength from other places, like clenching their buttocks or squeezing their legs together.
Exactly. Or, the most dangerous one, they hold their breath.
Why is holding your breath so bad?
Because if you hold your breath, you lock your diaphragm in a downward position.
Oh, you're spiking your own intra-abdominal pressure.
You are fighting a war against the exact muscles you're trying to lift. You have to keep breathing.
That makes so much sense. And integrating this 12-week protocol into daily life without it becoming a chore is tough.
That's why PTs heavily recommend tech, like the NHS Squeezy app.
Yeah, the sources mention using push notifications, or a trick called habit stacking,
Right. You tie the exercises to something you already do every day.
like doing your quick squeezes at a red light or slow pull-ups while the kettle boils.
Consistency is everything. If you do it sporadically, the muscle won't change.
But let's pan out for a second. We've talked all about rebuilding the foundation, but we have to talk about treating the root cause.
Yes. The holistic approach. You can't just treat the mechanical symptoms.
Because it's completely counterproductive to spend 12 weeks doing intense PT if you aren't stopping that heavy piston from slamming down in the first place.
It's like bailing water out of a sinking boat, but refusing to plug the hole.
Right. So if asthma is causing the cough, you need medical management for the asthma.
Or if you smoke, you really have to quit for the tissue to heal.
And the sources also point out it's not just coughing. Carrying excess weight puts a passive load on the hammock.
And constipation. That is a massive hidden enemy.
Really? Just straining in the bathroom.
Straining forcefully mimics the exact same downward pressure spike as a violent cough,
Wow. So you could be doing your pull-ups religiously, but undoing it all on the toilet.
actively undoing your progress.
Yeah.
So hydration and fiber are literally pelvic floor therapies.
That is such a good point. But let's look at the most frustrating scenario.
Okay.
Say someone is hyper diligent, they master the neck, they do the 12 weeks of training, they eat their fiber.
But the laxity is still there.
Yeah, because, like we said earlier, menopause causes a literal biological loss of collagen. You can't just exercise collagen back into existence.
No, you can't. There's a biological ceiling.
So what happens then when PT just isn't enough?
That's when specialized urogynecology centers offer alternative avenues, like minimally invasive vaginal rejuvenation therapies.
Like the FemiLift. I've seen marketing for vaginal lasers, but how does a laser actually tighten loose tissue?
It's based on a concept called controlled thermal injury.
Wait, you're injuring the tissue on purpose?
Yes, but at a microscopic level.
Yeah.
The laser targets water molecules and creates tiny, painless thermal wounds in the connective tissue.
So it tricks the body into thinking it's been hurt.
Exactly. And that triggers a massive localized healing cascade.
The body sends in the repair crew.
Right. It floods the area with fibroblasts, which build structural proteins,
But you get neocollagenesis, brand new collagen.
and new blood vessels. The tissue actively thickens, plumps up, and regains a lot of its elasticity.
That is incredible, manipulating the healing response like that. And what about hormonal treatments? The sources mention ospemifene or DHEA.
Those address the estrogen deficiency directly. They restore the acidic pH, improve blood flow, and thicken the mucosal lining.
Which makes everything more resilient. But we have to center this conversation before we wrap up.
Absolutely.
Because the medical guidelines from the Cleveland Clinic and the NHS are very consistent here.
PT is the first-line treatment, always.
Right. Lasers and hormones are complementary. They are secondary to the muscular foundation.
You simply cannot bypass the muscle. And surgery is generally only for severe pelvic organ prolapse, not general laxity.
It all comes back to the foundation, which brings us back to where we started.
The base of our core is not a static slab of concrete.
No, it's a living, vulnerable suspension system. And a chronic cough will ruthlessly exploit that vulnerability.
Hammering it with intra-abdominal pressure.
But you have the mechanical tools to fight back.
You really do.
Yeah.
You can retrain your brain with the knack to create that immediate physical shield.
And endure that 12-week protocol of pull-ups and quick squeezes to literally rebuild the muscle fibers.
We just have to take the maintenance of that foundation seriously.
Which leads perfectly to a final thought I know you wanted to share from looking at all these sources.
Yeah, I think there's a really profound shift in perspective we need to have. Think about when something suddenly flies at your face.
You blink.
You don't even think about it. You blink. We have an automatic, hardwired reflex to protect our eyes, and we just consider it a fundamental given of human biology.
Right, you'd never just accept it if you suddenly couldn't blink anymore.
Exactly. But we also have this internal reflex designed to instantly protect our pelvic organs from the violent pressure of a cough.
And when it gets damaged by childbirth or age,
People just brush it off as a normal part of getting older. It's almost always met with shame and silence.
which is entirely unacceptable.
What if we viewed maintaining our internal physical reflexes as just as vital as protecting our eyesight?
What if we stopped accepting structural failure in silence and started actively reinforcing the bridge?
That is the question you should be asking yourself today. You are the engineer of your own foundation.
Beautifully said. To you, our learner, thank you so much for bringing us this critical mission and for joining us on this custom-tailored deep dive.
Take this knowledge, maybe share with someone who might be suffering in silence, and start building that foundation.